Wickham practice is a well-established practice. We've got 16,500 patients that we look after and a clinic for people that have been affected by stroke. We see them to find out how they're coping with their illness and to make sure that all the factors that might cause them to have a stroke in the future are addressed fully. In the last year or two, we've been really trying to concentrate on people at very high risk of stroke because of a condition called atrial fibrillation, where people's heart beats irregularly, and that can increase their stroke risk as much as 6 or 7 times to that of the general population. I'd like to change the medication. We decided to try out a toolkit called Grasp AF, and what that toolkit does is identifies all the people with this irregular pulse, can see whether or not they're taking aspirin or other drugs to thin their blood called warfarin. People at high risk of stroke should be taking warfarin wherever possible. We then reviewed all the patients at high risk of stroke and identified the ones where warfarin could be tried. We then rolled that model out across the whole of Gateshead. All 34 practices took part in the project. There were 104 people who were at high risk of stroke who weren't on warfarin before, who at the end of the year were now on the right treatment to reduce their risk of stroke. We've worked with the Stroke Association on several campaigns. It's been really helpful because it means now that whenever there's any new campaign, the Stroke Association are able to, through this practice, reach out to all the practices in Gateshead. I would encourage as many practices as I could to contact the Stroke Association, to get them to come and talk, to get them to talk to their patient groups and patient forums, and to engage as much as they can.